Hello and welcome to the Knee Pain Guru Knee Pain Questions Answered. And this week I got a question from Ruth out of Arlington, Texas. And she writes, I'm not sure if I'm emailing you at this address. I will keep you informed on my progress. I did download the book, but I wonder if I did the wrong thing. Ruth, by the way, I have my assistant on this to make sure you've gotten everything taken care of. And you have the ebook that you can check out. I am 85 years old and I am desperate to get rid of my pain. In June of last year I had partial surgery on both of my knees, the insides, and though I went for therapy at the hospital for at least 2 months, the pain is getting worse and I'm not sure if I could stand stronger medicine. I know exercise is the answer, but I don't dare get down on my knees. It is almost impossible to get up. Nor can I lie on my back on the floor for the same reason. Do you have any suggestions for me? I went on the internet last week and found your website, which made me hopeful that maybe I could live out the rest of my years without pain, or at least not as much. The orthopedist gave me a steroid shot in each of my knees, which didn't do anything for the pain but threw me into a deep depression. So now with all of the other medicines I take, I have added antidepressants. Thankfully, they do work. I would much appreciate any advice you can give me. Ruth. Ruth, thank you so much for your email. I do appreciate and I empathize with your situation. As far as suggestions for you, I mention almost weekly about increasing your water intake, and that's going to be a huge piece as far as helping with the knee pain. As we get older, what happens is the body's ability to absorb water decreases. It's something like when we're born, we're 90% water, and by the time at the end of our lives, I believe the statistic was something like 60 or 70% water, which is a lot of the reasons why people get more brittle and frail as they get older. This also contributes to the space we have between our joints, the lack of water. So increasing your water intake is going to help with that. One thing to understand about increasing your water intake is you can think of the body like a dry sponge. And like the dry sponge has been sitting by your sink for a few weeks and it's really hard and brittle. And when you first put water on it, it takes a little bit of time for that water to get absorbed into the sponge. However, if you continue to work the sponge, then the water is going to absorb into it much quicker and it's going to be very pliable. The body works the very same way. So when you start drinking water, when you increase your water intake, you're going to want to be consistent with that. At first, the water is going to run right through your body. You're going to be running to the bathroom every 5 minutes. And this can be kind of annoying. However, when you understand that that's the process of how the body is going to condition itself to absorb more water, then you can understand like the end result that you're looking for. So as you increase your water intake and be consistent with that, then the body is going to retain the water more, and that's going to help flush out the toxins that are going on in your body in the space that's reduced between the joints and the bones in your knee. So that's one suggestion I can make. Another thing as far as exercises, you don't need to get down on the floor and you don't need to be down on your back to do viable exercises that are going to help you get that movement back into your knees and get you out of pain. One of the pieces is in the book that you got. It's the leg swing. And what I do is, you're basically sitting at the edge of a table and you're swinging your legs to and fro, back and forth, side to side, and a few other directions. One thing I'd like to add for you specifically, Ruth, is to drink a big glass of water while you're doing your exercises, while you're swinging them. Now, what is that going to do? First of all, you're going to get the body moving while you're drinking the water. This is like working that sponge example I was telling you about. And that's going to be able to get the water moving around your body while you're sitting there and absorb into the knee joint. I believe that if you do that for a couple minutes, 5 minutes every morning while you're drinking a big glass of water, that's going to have a significant help for you with that. Another piece is when the body gets dehydrated, one of the symptoms for dehydration is depression. So, you have more pain, the body gets more tense, which squeezes out more water, which exacerbates or makes worse the issue of the chronic dehydration in the body. So it's kind of like a downward spiral. You get on this hamster wheel, so to speak, that's going to be very difficult to get off of. However, increasing your water intake, doing that simple exercise in the morning, and if you really feel ambitious, do it once in the morning and once in the evening for like 5 minutes. Double check with your doctor just in case to make sure he's cool with it. That, and continue with that, and keep me posted on the progress. Send me an email, go to my website, thekneepainguru.com, and go to the contact section and send me an email to keep me updated of the progress, as well as if there are any more questions. So, for those that don't have my book, and for those that do not have my video, definitely go to my website and check that out. Get yourself a copy. Start doing the exercises because they significantly help strengthen the tendons and the ligaments within your knee joint. Thanks a lot, and I'll talk to you soon. Bye-bye.